You were still on to Cosmopolitan Market. And like I said before the break, the Africa Polling Institute, which is an Abuja-based opinion research think tank, has released two reports on polls conducted recently. And my guest, Olugbenga Ogunmefun, who is the Assistant Director Research at the Africa Polling Institute, is seated right here with me, and we shall be discussing issues around your findings. Welcome to the program, sir. Thank you very much. Thanks for having me. Thank you for coming. Okay, and so starting off with one of the polls that were carried out recently, the one titled Socio-Economic Implications of Covid-19 Pandemic on Rural Women in Nigeria. Yes. I would love to know what motivated this research. I mean, why did you choose to research on women, and why women in rural areas, and what were your findings? Yes, the COVID-19 issue is pandemic. It's here with us in Nigeria, and it's been challenging for every citizen of the country. But particularly in the rural areas, we know that our citizens there have general issues, infrastructure, income, development, and everything. I'm decided to focus on that aspect. But not only in the rural areas, particularly the women, who are the main builders of the homes. Many of these rural women have challenges, health-wise, economic-wise, even family issues. I'm decided to focus on these women to find out how they are coping with this pandemic within their own communities. And some of the findings, they found that in terms of awareness, are they even aware that there's COVID-19 in Nigeria? And 54% of them said, yes, they are aware, but 46% of them said they are not aware. So that's it's a challenge on its own, that down there in the rural communities, the level of awareness is not high enough, despite the fact that across the country, the awareness has come up a little bit. And that was a major finding of the study, that level of awareness is not as high as it ought to be, because these are people that are naturally, they are at the lower bottom of the pyramid. They're having challenges, both natural and economic and what have you, and not being aware fully, not having a high level of awareness of the pandemic itself. It's already putting them at a disadvantage within the country. Yeah, Mr. Olugbenga, you made a very valid point there. You said women are play a very key role in breaking the poverty line, and they are as important as they are in the value chain. They are usually sometimes even forgotten. But in your findings, what measures did some of the respondents say will help, especially in rural areas where livelihoods were badly affected? Well, most of these women, what they do basically is petty trading. A higher number of them are into petty trading. They are sources of income. About 31% of them are into petty trading. About 27% of them are in the agri business, farming, produce, selling, all the other chains of agricultural. And 15% of them, the respondents spoke to, are unemployed. So basically they are housewives. How will this affect their economy? How will this affect their livelihood? And we know that during the lockdown, there were issues, domestic issues. Husbands couldn't go to work. Frustration levels were high. The farm produce they had, they couldn't sell them. Their storage capacities are bad. They don't have good storage capacities that will preserve all these goods. The ones that they have, they couldn't take it to the market to sell because the markets have all been closed down. So all these issues became a very volatile issue within their communities. And in terms of palliatives, they had no palliatives coming from the government. 89% of them said they received no palliatives. So their subsistence living was totally destroyed, so to speak. They became more traumatized. They had to assist their families. They had to assist their husbands. Some of them are widows, having many children to cater of, beg your pardon. And these issues became very, very strong within the communities. And the government were expected, to some extent, to alleviate their poverty, alleviate their pains, alleviate their discomfort. But this wasn't really forthcoming. But we'll find out during the survey. And you mentioned that 89% of these rural women said that they didn't have access to palliatives. What factors did they say was responsible for their inability to have financial assistance, especially during the lockdown amid the pandemic?
Well, when we ask them if they have any access to financial assistance, be it loans, be it grants, 95% of them said no.
What was their reason?
They were not even aware of.
Okay, lack of awareness.
They were not aware that they could even access any funds. They could access any grant. They could even go out of their way to source for alternative means of funding for their projects, for their businesses. 95% of them they were not aware of. And this is a major issue that really affected the livelihood of these people. Farmers, factors hindering their financial aid assistance, there was no information. 65% of them, they had no information absolutely. No information at all. They don't even know where to go. They don't even know how to go about it. They don't even know that they could actually access some financial aid. 65% of them. 11% of them, they are not even interested. They are not interested in going about it. Some of them, another percent, 11% said they have no financial institutions. We are talking about the rural communities. So all these factors inhibited them from getting access. So if they are not aware that they could actually get access to these financial aids, there's no way to be able to access these financial aids. So there was no assistance coming from any quarters. The palliatives that few of them had about coming, they were not able to get these palliatives across to them at all.
Okay, you have mentioned that 65% of these women said they were not even aware of how to get financial aid. And you said 11% of them were not interested.
Yes.
What does all of this say? I mean, these are large numbers, especially talking about 65% of women saying that they were not aware. What does all of this have to say, especially regarding financial literacy in Nigeria?
Lack of information is basically key. If they don't have the information to go and get this financial aid, there is no way that their families could be helped. There's no way that their communities will be helped. There's no way that development, even within their own small structures, could be helped. They don't have this information. They cannot get an alternative means. When the lockdown came, they were totally locked down in the real sense of the word. The husbands couldn't go out for those of them who are married. The widows amongst them, they could not take their produce to the market to sell. The few of them that works within government establishments, like the health institutions, some of them that work in the local primary schools as teachers, they could not go anywhere. There was no alternative to them. So the little that they had prior to the pandemic was exhausted while they were still in the lockdown. So what is the alternative? And that was where the issues of domestic violence reared itself, where some women had to go out of their way to sell their bodies. There was a viral video then of a woman that she had no, all she wanted was to feed her children. And if it means selling herself, her body, to get money or to get food to feed her families, then so shall it be. There was a viral video there that people rallied around that woman and helped. And that was just an example of what actually went down, particularly in the rural communities amongst the women. So there is no alternative for them. Their financial lifeline is stronger into what they can get there and then. There are no alternatives, no other corners they could turn to, because the government was not forthcoming. We are not even aware of. There are some government empowerment programs that are supposed to get down, particularly below the pyramid of Nigerians, people that are below the pyramid, people that are poor. For example,
the Survival Fund.
But nothing. They were not even aware of it, not to talk of being able to access it. And those that were willing to, said there were no financial institutions within their communities, about 11% of them.
Okay, having done such an elaborate, in-depth and robust study, what are the recommendations that you would want to put out there, especially regarding, like the topic says, the socio-economic impact of COVID, particularly on rural women?
Government has to come alive. I say come alive because these are the people that are really affected. We saw the events surrounding the issue of palliatives all over the country. These are the people that really need these palliatives. Government, we have NEMA. NEMA could be given out a mandate because they have presence in all the countries, so many local governments. Let government really move and get these palliatives to these people. all the empowerment programs of government. You see, the funny thing is, when it's time for politics, every nook and cranny of this country, politicians will get to. So the same methodology they use in making sure that they get the votes, they should employ the same methodology and get access to these people. Let all these things trickle down. In terms of ICT, many of them have phones, though. They can communicate. That mobile phone that they have, government. And when we say government, we are not necessarily talking about the federal government. The closest government to them are the local governments. They see them, they know them, they feel them. So the local governments can have a software. They can do something to make sure that even the mobile phones these women are using will be a source of great information. They can get across to so many people. Storage facilities for their farm produce. It's a community. A local government. Put them together, aggregate them together. Produce by produce, community by communities. Let these people have access to all these things. Meet them. There are issues of domestic violence because of frustration meted down on these women by their spouses, by the communities themselves. When some palliatives do come, the strongest amongst them will get them, and these are the men. So government should make sure that they have these channels of communication with the people. Awareness is key. Awareness is the main thing for everything. If you are not aware that government has palliatives, if you are not aware that government has some programs, if you are not aware that government has some financial aids, if you are not aware that government, even through your phone, you can access health, you can access wealth, you can access information, then you are not moving anywhere. So government has to come alive in every area of the lives of these people and get down there and meet these people at their point of need.
Okay, I am quite curious, Mr. Olugbenga, because I know you are someone that has interacted with people at the grassroots.
Yes. Based
on your survey here. What are your thoughts? I mean, there are indications that it just might be a second lockdown. What are your thoughts on that?
Second lockdown is a no-no. It's a no-no for Nigerians. It's a no-no, mainly because of economic reasons. The first lockdown came, and because most of Nigerians, a greater number of us, it's 60–65% as the last time, are from the informal sector. So they live basically day to day, from hand to mouth. They are not in the structured sector. So their livelihood is dependent on what they can get on a daily basis. Your artisans, your traders, your market women, your transporters, they need movement. So when they were locked down, they were really locked down. They weren't really prepared. So what alternatives do they have? Economic activities were grounded, income grounded, daily livelihoods grounded, suffering all over the place. So people are averse to that. They don't want to have that experience again, because what was supposed to be as a breather for them, to serve as palliatives, never got to them.
But can we ever be prepared for a lockdown?
What are the lessons from the first lockdown? That should be the question. Has government learned from the first lockdown? Are we really prepared for a second lockdown? Personally, I don't think we are. The indices are there that the government is not really ready. Government wants everybody to be safe. Government wants everybody to be health-free, to be pandemic-free, rather. But our people are mainly leadership-focused. They look at you as a leader, and they toe your line. But when people at the top are not adhering to the protocols of the NCDC, the protocol of the PTF the monitoring group, the people are not really expected to. We have no moral justification enforcing such rules. When you are the top, that they see religious leaders, political leaders, community leaders, we see them flouting all these rules. So when these people are flouting all these rules, the people below that are looking at them as examples and saying, no, it's not here. We don't believe in it. We can see our leader is not using it. Why should I use it?
So in essence, you're recommending that they lead by example?
We have to lead by example. The government has to show the necessary examples. The government has to put everything in place, all the lessons learned from the first lockdown, before they can even consider, not even locking down the second, but even considering it, that we may go for a second lockdown. So if all those protocols are put in place, then there may not be need for the government to consider a second lockdown. People are not wearing their masks. You see, most people have a second jaw because they put it below their neck, down their throat, and hang it there. You'll be talking, communicating with somebody at close proximity without wearing a mask. It's not something that, from our findings, that people are willing to accept in terms of having a second lockdown.
Okay, intense one there. You are still on to Cosmopolitan Market, and we shall be going on a short break. And when we come back, we then shall be discussing the second public opinion poll, which reflected an update on the coronavirus disease. Stay tuned. We shall be right back shortly. And you are still on to the Cosmopolitan Market, coming to you live from the Nigerian Customs Broadcasting Network. And before the break, I had said that the African Polling Institute, which is an Abuja-based opinion research think tank, has released 2 reports. And just before we went on the break, we had discussed the first one, which is titled The Socio-Economic Implications of COVID-19 on Rural Women in Nigeria. And my guest is still with me, and he is the Director of Research at the API, and he is Olugbenga Ogunmefun, who is the Assistant Director of Research at the Africa Polling Institute. And now we shall be moving on to the second opinion poll that is reflecting an update on the coronavirus disease. So, sir, going on to the second opinion poll that yes. That was conducted by the API. Okay? Let's start with what your methodology was and what your findings were.
We used the modified stratified sampling technique to get our respondents. We used the 2006 population census, and we stratified them in sectors and brought everything to bear. We weighted the data, and we spoke to exactly 2,060 respondents for the COVID-19 research. And our findings generally, Nigerians believe that indeed there's COVID. It exists. About 95% of states, yes, COVID-19 exists. It's in existence. And about 75% of states, yes, it is in Nigeria as it were. They believe that it's in Nigeria, but the measures, the protocols that the government has put in place for them to avoid contracting this virus, how consistent are they in keeping to this? The wearing of masks, the washing of hands, using of hand sanitizers, and social distancing. And we found out that gradually people have started moving away from strict adherence. They still wear their masks, but no, just few of them always wear their masks. About 21% of them always wear their masks. 43% of them say they wear it often. In terms of washing of hands, 16% of them said they always wash their hands, and 43% of them said they often wash their hands. In terms of social distancing, 16% of them said they observe it religiously, while 36% of them said often they do that. People have started moving out. There's this feeling that it's gone, it's going. You go to the market, you see all people all over the place, they hang it. Some of them, you ask, where's the mask? It's in my pocket, they bring it out. They don't really believe that. They have not really, they feel that I've not seen, I've not had somebody close that has been rushed to the hospital, or more importantly, that has died of it. You only hear. And when they see people, like I mentioned earlier, that are supposed to be their leaders, that are flouting all this. We've seen government officials on video dancing, congregating together, no social distancing. These people take, like the military said, they take dressing from their right. They look at these people, they observe what they do. And that gives them the courage that probably this thing is not there. Some of them believe that they are immune to it. The local, we have the local herbs, it does not affect Africans, people that are dark, those are the initial narratives. But eventually, when people, like when the late Chief of Staff to the President died, Abba Kyari, people say, is it really? Could it be? Now, more prominent people are coming out to say that, okay, indeed, I have contracted it. So people have started sitting up. But still, that initial grip that this thing may be real, excuse me, is gradually waning.
Okay, you mentioned that the level of compliance based on your research is low.
Yes.
And the poll also states that 8 in 10 Nigerians stated that they would not support a second lockdown being put in place. What were their reasons for such decision?
84% said they are not going to support.
That's quite high.
They are not going to support. And mainly, they are all because of economic reasons. They said distress and suffering that they went through during the lockdown. 43% of them said they suffered a lot. There were a lot of distress. Economic reasons, the economy has been affected. Their livelihood was destroyed. They have little or next to nothing to live by. There were no palliatives by the government. 9% of said no palliatives by the government. 8% have said it will worsen the economic situation. So mainly it was because of economic reasons. And that is because majority of Nigerians are from the informal sector. They live daily, hand to mouth. Their livelihood, their subsistence is on the daily. We spoke about the rural women, for instance. They couldn't go to the farm. There's a lockdown. They couldn't go to the farm. The little they had was extinguished. The ones they had in storage, they couldn't take it to the market. So it got spoiled. It got rotten. So the ones that they could live on, they lived on them. The others, they had to pour it away. Some of them are perishable goods. Some have to resort to alternative means of income. And the main alternative means of income for them then was to sell their bodies because they're women. What about the men? The men became even more frustrated. They couldn't go out. There were security issues. The little that others have, they are willing to steal to survive, and some to feed their families. So for mainly economic reasons, Nigerians are not willing to go through the second lockdown.
Okay, so now let's talk on COVID-19 vaccines. We understand that talks are ongoing with the Chinese government regarding COVID-19 vaccines. But I would like for you to throw more light now on the part of the poll that shows the readiness to take COVID-19 vaccines if made available versus the justifications for taking it.
60% of Nigerians said, from our samples, I said, they're willing to. They're going to take the COVID-19. And why? Because 51% of them said it's going to improve their immunity. They know the virus attacks the immune level. So they want to be secured in terms of their level of immunity. 51% of them said they are going to take the vaccine mainly for that reason. And 22% of them said that vaccine will protect them and also curb the spread of the virus. They don't want the virus to spread, and they believe that if they take the vaccine, it's going to curb the spread, irrespective of the use of masks and all the other protocols. The main thing is once they have the vaccine in their body, it's going to curb the spread. Even if people come in contact with them, there's that likelihood that they may not be able to transmit the disease to them. So that is another reason. Another reason is that 14% of them said COVID-19 is deadly. It is dangerous. It kills. And that's the main reasons. Those are the main reasons why they are going to take the vaccine. On the other hand, 25% of them said no. They are not going to go for the vaccines. One, it's not here. Like I said earlier, they don't believe it's here. 41% of them, and that's a high figure. 41% of them said it's not here. They're not going to have the vaccine at all. Some of the scientific issues, about 25% of them said they've had, and some that have not even had are worried that there may be side effects of the vaccine, and they don't want to put themselves under that strain. And about 16% of them said they are not at risk at all. Nothing is going to happen to them. These are people that believe that, the blood of Jesus. These are people that believe that I'm secured. My family history, my family tradition is going to protect me. I don't work anyhow. I don't go to places I'm not supposed to go to. These are the people that believe that. 60% of them that it's not going to happen. It's not going to happen to them at all. Whereas 15% of them said, well, neither right or left. I don't know if I'm going to have the vaccine done. But 60% of them are willing to have the vaccines administered on them. And I read somewhere this morning that the president, his vice, and the SGF are going to take it public life to encourage people.
I was just going to go to that, but don't you think this is going to affect, in a positive manner anyways, the perception of Nigerians regarding the vaccine?
Well, if you look at it vis-a-vis the strict adherence to the protocol preventing this pandemic, wearing of masks, washing of hands, using of hand sanitizers, and social distancing, that top people, leaders, did not strictly adhere to during the first lockdown, and even presently, it's a step in the right direction, I'd say. If the president takes it, if the vice takes it, if the Secretary of the Federal Government of the Federation takes it, the president is seen as an elderly person. He's respected. The vice president is seen as a pastor. So if you look at it politically, if you look at it from the religious angle, and of course the Secretary of the Government of the Federation is being the face of the task force. So when people see these people, when Nigerians see them, hopefully that should raise the level of awareness, and also the fact that if they can take it, then we also should have that confidence, because 60% of them have already said they are willing to take it. So that should be a kind of a booster.
Okay, so having done this survey now, yes, I would like to hear your recommendations on this poll, especially, I mean, just recently we got news that the new strain of COVID-19 just might, yes, be in Nigeria, and, yes, we're seeing lockdowns in different parts of the world, in the United Kingdom, yes, in Tokyo, even in South Africa here. Yes. So what are your recommendations, you know, going forward?
I think the first one is strict enforcement of the protocols of both the NCBCTV and the Ministry of Health. Strict enforcement. Because when people see that they can get away with it, they can become relaxed. They don't care whatever anybody says. But if they're going to be punished, and rightly so, and when I say punished, everybody, there should be no second count. Like I mentioned earlier, we are seeing government officials, top-level government officials, who have flouted all these protocols, and nothing has happened to them. So when you use them as an example, and people see, then people will know that, yes, they really need to sit up. Secondly, government has to buy in all the leaders, the community leaders, the political leaders, the religious leaders, the market women, associations, groups. They have to key in. Government has to sit everybody down. This thing, you can't keep blaming government. The government has said these are the preventive measures. Everybody has got to come to the party.
How do we get Nigerians to take responsibility? Like you just said, we can't keep blaming government.
Yes. Everybody must take responsibility. That's why it must cascade down to the level. In the community, for instance, the village heads, people respect them. They listen to them. When we are going for service like this, the first port of call will be to these village heads. Mm. They will give us the clearance. They will tell us, go here, these are the things you need to do. They listen to them. So when they see them wearing this, and they tell them, you must, people will adhere to this. You cascade it down. The religious, Nigerians, they are very religious. When the pastor says, this is going to happen, don't do these things, they would adhere. And when you now make sure that there is enforcement in place, not the sort of enforcement that people will turn the other eye, collect something, and if you go to some business places now, as of today, there's no more enforcement. You can go in, they won't bother asking you to wear your mask. Some they put the temperature, some they will not, some they give you hand sanitizer, some they will not. The complacency is almost everywhere. So there has to be enforcement, there has to be key in by the leaders, there has to be punishment for those that breach these laws, and government has to communicate. Let government communicate. You
think there's a breach in communication?
There is. There has always been. That breach in communication is there. How many Nigerians watch TV? Do they even have light to watch the TV? There should be other means of getting these messages across. Get the telecoms and companies involved. Somebody called in the program that in Rwanda, there are mobile promotions going on. Mobile communications. People go out and you see them in vans, in buses, telling people how to go about their businesses in this pandemic. Wear your mask, social distance yourself, use hand sanitizer, wash your hands. In schools, wash your hands. The children must know that they really need to wash their hands. They have to observe all these protocols. So that communication that is lacking, there's this breach. Let them come in. Then ICT. When we say there's a lockdown, people can go online and transact their businesses. That is the time the internet service providers have to be up and running. All that they need, government has to assist and make sure that everything works seamlessly during this period. We have to move up to technology. Technology can help. Information on health, information on finance, information on the economic, all these things can be sent via the phones. People can access all this, and even the rural women that we mentioned. So all these avenues have to be explored by government. And of course, government has to show their face. In terms of palliatives, they have to really, you know the war we went through. Nobody is willing to go through that again. No.
Okay, I have been speaking with my guest, Olugbenga Ogunmefun, who is the Assistant Director of Research at the Africa Polling Institute, and we have been speaking on surveys that were conducted by the African Polling Institute recently, and both of them actually geared towards COVID-19. The first one is on rural women on women in rural areas, and the second one is on perception of Nigerians regarding COVID-19. Thank you, sir, for the very insightful conversation.
Thank you for having us. I appreciate it, and let's keeping safe.
Of course, of course. This is where we draw the curtains on today's episode of Cosmopolitan Market, coming to you live from the Nigerian Customs Broadcasting Network. Do well to join us again, same time, same station tomorrow, as we promise to bring you yet another insightful program. I am Chiamaka Inendu. Bye for now.